Alright, so one of the unique things that have come out for allergic symptoms are nasal steroids. They're a great medication to use. They were originally prescription, but now you can buy it over the counter in most of your pharmacies that you go to. So when would you want to use a nasal steroid? If you have tried almost every medication out there and you're still not getting any kind of relief, or you want extra relief from the antihistamine that you're taking, and this might be the best option for you. I will say, as far as steroids, there are a couple things that you do want to take into account. Most of the steroids will only be applied through the nasal passage, so maybe that's not your thing. That might be something you want to miss out on. Secondly, they do kind of be expensive, a lot more expensive than you can get for some of the antihistamines that you can get. And of course, these are steroids, so one of the things that people do happen when they do take this medication is that when it's applied, they want to immediately work right away. And that's kind of the limitation about this medication. It might take 2, 3, or maybe even 4 days before you get maximal effect of that medication. So it's a medication that you take in planning that you will have allergies, and then over time it gets a little bit better and you have decreasing symptoms each day, and usually maximum effect about 5 to 7 days. So again, it's a great option, but it's kind of limited. It's not something that's going to work right away, and always take into account. As far as side effects, it's quite minimal. The most common one would probably be a dry nose, and maybe sometimes nosebleed. It's usually just the medication. When it is applied, it can cause a little bit of dryness, so sometimes it's a good thing for some people, but for some people may not like that particular side effect.